This PowerPoint will discuss physical and verbal interventions for at-risk behaviors of students in the school setting. The integrative experience uses 4 categories in which to determine behaviors. The first category is anxiety, which is a change in behavior. Teachers can combat this crisis development in a supportive manner using empathy and a non-judgmental approach. Defensive behavior is where a student is beginning to lose rationality, and we can be directive with these students and decelerating and escalating behavior. Risk behavior may present a risk to the student or to others, so physical intervention may be necessary to disengage and manage those risk behaviors. Finally, the tension reduction is a decrease in physical and emotional energy, and we can combat this through therapeutic rapport, which is where we can reestablish a communication with the student. Verbal intervention is one of the first intervention methods that you'll use with students. There is a verbal escalation continuum, so a student on this continuum is going to continue to escalate using these things. First, they will start with questioning, they will refuse, they will release, they may intimidate, and then we may get into the tension reduction where we can use that therapeutic rapport. These types of behaviors are exhibited in the defensive level of the crisis development model. The decision-making matrix will determine which level of intervention that we use. So if you look, down here is the least risk, medium risk, and our higher risk behaviors. It's a tool to help assess the risk and make an appropriate response. So the likelihood of something happening and the severity or outcome of the behavior. So the risk is the chance of the bad consequence. Our likelihood we just went over, as well as the severity or outcome of the event. In these situations, when we are at our higher risk, possibly even our medium risk behaviors, we're looking at using a team intervention. A team intervention is used for safety, professionalism, and litigation. The team leader would be the first person that is on the scene. They would be the person that has the best rapport with the student and is going to be the most likely to de-escalate that student in the moment. So team intervention is a major part in the decision-making matrix, and it's what we use to combat any problems that could arise. Now there's some few warning signs that you can look out for, both in their breathing, their heart rates, in their physicality, and things like that, in order to show that students are in distress and will need an intervention from an administrator or teacher. Now the disengagement skills are used for physical intervention. There are a number of ways in which we can use this. There are 3 levels of physical intervention: low risk, medium, and high risk. So depending on the situation, we'll determine which level of physical intervention to use. So in choking, we have lower risk, medium, and higher. Same with hair grabbing, grabbing of the arms or wrist, grabbing of the shirt, grabbing from behind, and also biting. Now, a lot of these lower risks, you're looking at those younger students that are coming to get love and things like that, so you can be a little bit more delicate. You slightly grab their wrist, you pull them off of you, you give them reassuring words. When you get to a medium risk, you have a student who maybe is having a bad day and they're coming at you a little bit, but they don't seem to have an intent to hurt you. But you still must be a little bit more rough with them in their detainment and pulling them off of you. Now, our higher risk students are the students that are coming out to hurt. They're there to cause you harm. And so there are physical interventions in which we trap the hand of the offender. We usually bend it and we pull away. And so those are the ways in which we combat this physical problems with students. CPI training is very important. You must renew it every year, and you must have the blue card or the CPI card in order to use these physical interventions on students. It is an 8-hour training class that you can take, and then renewal classes are 4 hours. And it's important to have these renewals because of changes and updates and different methods in which to combat physical activities in students who may be of harm to you or to themselves or to others. Thank you very much.